Assemblymember Lowenthal, please proceed.
Thank you so much, Madam Chair. We have another witness who's in the restroom who will be joining. Boy, all this talk on coffee. Down to 1 cup a day. Thank you, Madam Chair, members. Very pleased to present AB 2105, which requires a healthcare service plan contract or health insurance policy issued, amended, or renewed on or after January 1st, 2025 to provide coverage for the treatment of pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections, or PANDAS, and pediatric acute onset neuropsychiatric syndrome, or PANS, prescribed or ordered by a physician or surgeon. I'd like to start by accepting the committee amendments and thank the chair and committee staff for their very thoughtful work on this bill. PANDAS and PANS are an inflammatory disease of the brain. They result in sudden onset, devastating behavioral and neurological dysfunction that usually occur after a triggering infection. These disorders are thought to be caused by autoantibodies generated after the infection that mistakenly attack the brain. Antibiotics or oral anti-inflammatory medication help most children, but a minority need stronger immune modulating treatments such as intravenous immunoglobulin or IVIG. Despite published PANDAS and PANS treatment guidelines that established a standard of care in 2017, insurers have continued to adhere to their own policy statements, forbidding authorization of immune-focused treatments such as IVIG. As a result, treatments are routinely denied. Early and expedient treatment of PANDAS and PANS is essential in order to prevent long-term and potentially life-threatening impacts of these conditions. Patients seeking immune-modulating treatments for acute PANDAS and PANS are frequently denied authorization for these treatments by insurers and must seek independent medical review at the Department of Managed Health Care. While the IMR process is effective, decisions are typically rendered within 30 days of qualification, meaning that the insured must first receive a denial from their insurer, file a request for independent medical review, and wait for a decision to uphold or overturn the insurer's denial. But unfortunately, it's too late. This timeline is simply too long for children suffering from PANDAS and PANS and is frequently leading to kids receiving treatment long after current treatment guidelines recommend. According to the Clinical Management of Pediatric Onset Neuropsychiatric Syndrome, early care for PANDAS and PANS patients is defined as receiving treatment within 2 weeks of diagnosis. Late care is defined as receiving treatment within 2 to 4 weeks of diagnosis. And very delayed care is defined as receiving treatment more than 4 weeks after diagnosis. Based on published clinical treatment guidelines for PANDAS and PANS, denials are frequently resulting in very delayed care for PANDAS and PANS patients, which results in worse health outcomes for patients and the need for long-term care, which results in greater cost to patients and their families, insurers, and the state. They say timing is everything, and in the case of PANDAS and PANS, it couldn't be more true. Early and expedient access to the treatments is crucial to the effective treatment of PANDAS and PANS in order to avoid the debilitating symptoms, potentially permanent neurological damage, sometimes fatal outcomes associated with these disorders. AB 2105 will ensure that individuals and families who are confronted with these disorders do not experience unnecessary delays in treatment that can lead to disastrous and tragic outcomes. It is my pleasure to introduce Dr. Angela Tang, the mother of a PANS child, and Dr. Susan Manfull, co-founder and executive director of the Alex Manfull Fund, who are here to testify in support of AB 2105.
Thank you. You'll each have 2 minutes.
Thank you. Good afternoon, Madam Chair and other members. Thank you very much for allowing me to address the committee on this very important topic today. My name is Susan Manfull. I am a native of Fresno, California, although now I live in New Hampshire. I have very strong ties in my home state here, but I have come to see you today specifically to testify about this bill. I am the co-founder and executive director of the Alex Manfull Fund, as Assemblymember Lowenthal just said. as this group supports research and education and awareness in pandas and pans. But I'm here today as a mother because my daughter, Alex, cannot be here today. She's no longer alive to tell her story, so I'm going to tell it for you in 2 minutes, I promise. She was a paragon of health. 1 minute remaining. Okay, I'm not talking fast enough. All right, until she had strep at the same time that she had mono. She was our only child, and she lost her life at 26 years old in 2018 because she did not have a timely diagnosis and treatment. In fact, she diagnosed herself with pandas. And then she was able to get an appointment with a top neurologist who confirmed her suspicions and ordered treatment. My husband and I, my daughter, then worked to prepare for this notorious battle with insurance companies. However, she died before she was able to get treatment. We donated her brain to NIMH and to Georgetown, where we established a brain bank called POND. That stands for Pandas, Pans, and Other Neuroimmune Disorders. It's the only brain bank in the country. So may I have 30 more seconds? Okay, thank you. Hers was the first brain in that bank, and in less than 3 years, we have 7 brains there. The youngest one is 14 years old. Most of them are teenagers. This is a remarkable growth for a disorder that's so little known and a brain bank that has not yet been promoted. Now, I'm talking about these brains as if they are commodities. They are not. In fact, I want to let you know that today, the family who donated one of the brains is celebrating the 17th birthday of that young person who died due to pandas. In Alex's brain, I can tell you the damage in her brain if you'd like, but she sustained brain damage. There was evidence of inflammation, exactly where the clinical symptoms suggested that damage should be and where the brain scans suggested that they should be. She had gliosis in her brain. That's evidence of brain damage that's seen in Alzheimer's patients, in MS patients, and other very serious neurological disorders. So please vote. Please support this bill. Thank you very much.
Thank you. Please go ahead.
I'll talk fast. My name is Dr. Angela Tang. 5 years ago, PANS struck down my 15-year-old. My healthy soccer player could no longer walk. My straight-A student couldn't write. He spat out food if an intrusive thought struck, and he needed me at his side even during his tortured sleep. We dropped out of school, work, and life. With 2 doctor parents, my son got every oral medicine in the 2017 treatment guidelines by expert clinics like Stanford and Harvard. When he could no longer drink, he was scheduled for a feeding tube. The guidelines say that the next medicine is IVIG, but policies by Anthem, Aetna, and others say that IVIG is not medically necessary, experimental, and unproven. I luckily work for a large medical group issuing authorizations and denials for 15 years, and my doctor connections got him IVIG with improvement in a week, no feeding tube. Today he's off medicines and he's a pre-med in college nearby, and one day he may be your doctor. My son got IVIG 7 weeks from onset. According to the guidelines, past 4 weeks is very delayed care. But of the hundreds of cases I've seen, including at the Stanford PANS Clinic, where I am now an adjunct clinical associate professor, not one has received IVIG faster than my son. The norm is months to years of brain inflammation before insurance agrees to pay or is forced to pay by regulators, or parents sell off assets to pay, or kids get institutionalized, or they die. My opinions are my own as an insurance insider, parent, and PANS researcher, and today I make good on the oath I took to become a doctor when I ask you to protect the youth who lack doctor parents. Some say that existing regulations where insurers use policies by nameless employees who have never heard of this diagnosis to automatically deny IVIG and then have 30 days to respond to appeals are sufficient for this urgent diagnosis. Please consider if insurer definitions of medical necessity should violate peer-reviewed clinical practice guidelines by which AB 2105 defines medical necessity. Let's stop insurers passing the buck to taxpayers in special ed, unemployment, and disability. This bill costs $7,000 to enact and less than a penny in insurance premiums. Just to wrap up today, I give voice to the youth whose brains lie at Georgetown and to doctors who are shackled in their attempts to help. And today, you choose for California's kids, no for Alex's path, or I for my son's path. Thank you very much.
Thank you. Are there any other witnesses in support? Please line up.
Good afternoon, Madam Chair, members. Thank you to the author, Awad Kadani, representing the California Children's Hospital Association. Very, very strong support. Important bill. Appreciate you.
Thank you. We'll do name, organization, and position only.
Erin Taylor on behalf of Memorial Care. Thank you. Please support this bill.
Mitch Steiger with CFT, a union of educators and classified professionals, also in support.
Brandon Marchi with the California Medical Association in support.
Nicole Morales on behalf of Children Now in support.
Jennifer Snyder with Capital Advocacy on behalf of the California Life Sciences in support.
Chris Whitty, PANS patient since 3 years old in support.
Dr. Denise Calaprice, a clinical researcher at Stanford PANS Clinic. Speaking on my own behalf, I'm the author of several of the studies that Angela mentioned, and the parent of 2 kids who did get very early treatment for PANS and very successful treatment, and I'm here in strong support.
Kelly Riley, Panda's mom, in strong support.
Diana Pullman, Executive Director of Pandas Network. I represent over 40,000 families nationwide and worldwide. I'm in strong support. Thank you.
I'm Don Pullman, the father of Garrett Pullman, who was the first child in California in 2007 to receive IVIG. As a footnote, just recently he graduated top honors from Berkeley in chemical engineering.
Thank you. David Gonzalez on behalf of America's Physician Groups in strong support of this important measure.
Sherry Strolson, PANS mom, and member of the California Coalition for PANS Pandas Advocacy. I support AB 2105 with all my heart.
Dr. Jamie Candelaria Green. I'm a researcher in special education and author of works on PANS and education, and the proud mother of a survivor of this dreadful disease who's now serving in our military. I strongly support this bill. Thank you.
Hi, my name is Jensen, and I have Pandas. We need your support. Kids cannot keep suffering. Thank you.
Hi, Elise Tavsberger, parent of Jensen and also Emery. Em, can you say hi? 11 years old, 1 adopted, 1 biological, 2 Pandas PANS. We need you guys. It's time. Thank you.
Jonathan Tavsberger, like a defibrillator for cardiac arrest, IVIG saves lives. Our kids, we saw it, saved
Just
their
your
lives.
name and organization,
Household,
please, affiliation.
Thank you for supporting 2105.
Thank you.
Saves lives.
My name is Violette Rodriguez Sofair, and I'm a proud mother of a 17-year-old with PANS and Pandas. I support this strongly. Thank you.
Excuse me. Good afternoon. David Sofair, father of 17-year-old Miranda, who is suffering from this crushing disease, and IVIG is helping her. Thank you. In support, strong support.
My name is April Ronay. I'm with the California Coalition for PANS Pandas Advocacy. I'm a public school teacher, and I strongly support this bill for my son Aiden and all children who need access to this medication. Thank you.
Are there any witnesses in opposition? Thank you. You'll each have 2 minutes. Go ahead.
Thank you, Madam Chair, members of the committee. Jed Hampton with the California Association of Health Plans, here regrettably in opposition to AB 2105.
We would like to thank the author, his staff, committee staff, and I do want to acknowledge and thank the witnesses here in support. Obviously, it's a very tough, very sensitive issue, and we certainly realize that and understand that, and are certainly sympathetic to that. So I did want to acknowledge all of the witnesses here in support today. I do want to point out that our primary concern with the bill is related to the absence of the medical necessity language, which is a standard condition for health plans in determining the coverage of specific services. In reviewing the committee analysis, it does appear that the author is going to be addressing that issue via amendments. We have not seen the amendments or the language yet on that, but we are looking forward to reviewing that with our members and seeing where that takes our member plans. We would also point out that both the Assembly and the Senate Health Committee chairs have introduced bills this year to begin the process of reviewing California's Essential Health Benefits Benchmark Plan for the 2027 plan year. And we do think that is something that we do support conceptually, and think that that's probably a better way of handling some of these benefit mandates moving forward. So look forward to being a part of that process. But we are opposed for the reasons. Look forward to seeing the amendment shortly. And again, thank the author, the sponsors, and the witnesses here in support.
Go ahead.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. We too are in opposition today. Would echo many of my colleagues' comments. We understand the sensitivity around this disease and look forward to having those future conversations and reviewing the amendments. As my colleague mentioned, the medical necessity standard is sort of the benchmark or rubric around how we design our healthcare products, and we've continued to sort of want to work with and have that discussion about the importance of including that standard, and would like to continue those conversations, especially in that broader discussion with the potential for a benchmark plan and the evaluation of the AHPs as these bills move forward this year. So thank you.
Any additional witnesses in opposition?
Madam Chair, members, John Winger on behalf of America's Health Insurance Plans would just echo the comments of Cap and Acklick. Look forward to future conversations.
Thank you. I'll bring it back to the committee for any questions or comments. Vice Chair.
Thank you, Madam Chair. I just want to say that, we see so many times where early detection, early treatment can make such a big difference in the quality of life of people, especially young people. We want to make sure that, we can intervene as quickly as possible. A devastating illness like this is one of those that I think all of us agree needs to get the treatment as soon as possible. I want to thank the witnesses for coming forward. I know it's difficult testifying here, but we hear you, and I will be supporting the bill.
Thank you. And I also want to thank the author for your commitment to this disease and for putting forth language that will hopefully strengthen this bill and continue to bring awareness to pandas and PANS. And I want to especially thank the coalition that I was able to meet with prior to this hearing to really help me to understand the true impact and the concerns that you have in terms of not being able to get timely treatment in a way that is helpful to you all. I also want to recognize that we are on both the Senate side and Assembly side going through a broader process, and I mentioned this to you all, that will look at the essential health benefits and know that will be another opportunity, if you will, to be able to look at addressing in treatments and conditions like this. With that, my recommendation for this bill is an aye. Assemblymember Lowenthal, would you like to close?
Yes, thank you, Madam Chair and committee. I want to commend the families that came here today and the proponents of this bill that came to speak. It's a very emotional issue. And I also want to offer a hug to those in opposition. I can see how challenging it is and difficult it is for you to be on the opposite side of this. This is an issue clearly that affects the families, but in truth, it affects all of us. We're all paying for not dealing with this. These families have to utilize, many of whom have to utilize state social safety net services because the onset is so acute and so debilitating that they have to leave their jobs right away to care for their children, their ailing children, for a process that will ultimately get approved. So there's a cost, a huge cost for us not dealing with this. I really, truly appreciate the consideration. Thank you, Madam Chair, and respectfully ask for your aye vote.
Thank you, Assemblymember Lowenthal. Do I have a motion? So moved by Aguirre Curry, seconded by Dr. Arambula. With that, Secretary, please call the roll. It is due pass as amended to appropriations.
Bonta?
Aye.
Bonta, aye. Waldron? Aye. Waldron, aye. Aguirre Curry? Aguirre Curry, aye. Arambula? Arambula, aye. Wendy Carrillo? Wendy Carrillo, aye. Flora? Haney? Joan Sawyer? Aye. Joan Sawyer, aye. Mainshine? McCarty? Joe Patterson? Rodriguez? Sanchez? Sanchez, aye. Santiago? Chavo? Chavo, aye. Weber?
That measure is on call. It needs one more vote. Thank you. We are going to move on now to item number 15, AB 2449, TA.